Welcome to Scolio Pilates. Scolio Pilates is a scoliosis-specific exercise form. That simply means that this exercise form is designed with the structural changes of scoliosis in mind. So scoliosis is not a postural decision. I didn't decide to sit like this for the rest of my life. Scoliosis is a structural change that happens in the bones and in the shape of the bones of someone with scoliosis. So therefore, if we're going to design a scoliosis program, we need to keep in mind that the spine itself is simply a different shape. And we do have a lot of joints here, so we can move this shape of the spine closer to neutral because we have movement in between these segments of the bones that may no longer be shaped like the physiologically normal bone that we see in a textbook. However, we have movement and we can bring the spine closer to neutral. And there's a lot of ways we can do that. So in Scolio Pilates, we have 4 elements that we focus on. And the first is breath. So as you can imagine, if this is the shape of your spine, then with every breath that you take, the diaphragm, as it moves in and out, will confirm this shape, as opposed to bringing the shape back to a more neutral position. So one of the first focuses that we use is the breath to try to help us to open up the opposite side of the spine. And there's several techniques we use to do that. We have to keep in mind that the diaphragm is a muscle that can get stronger. It's a muscle that gives us a lot of support from the inside and can help us to move this shape back to something more physiologically normal. With breath, we also focus on elongation. So elongation is a little tricky. So do we just elongate someone? Do we have them just do the most elongation they possibly can? Well, yes and no. The most mobile parts of the spine with scoliosis aren't necessarily the places where we want them to elongate from. The places of the spine that tend to move the least in the middle of these curves are going to be the hardest to get to. So how do you create an elongation that truly focuses here in the segments that are a bit stiffer and a little bit less on the segments that are a bit hypermobile? It's definitely something that we work on in Scolio Pilates because we don't want to put the joints that are hypermobile into jeopardy. After breathing in elongation, we add corrective movements. And these corrective movements are either a direction that comes from you, the practitioner, of derotation, and let's please take the ribs to one side. But it can get very complex very quickly. So early on, we created wedges. And these wedges are basically intended to be an extra pair of hands for you, the practitioner. We use the flats when someone is lying prone, and we use the more wedge-shaped scolio wedges when someone is lying on their back in supine. These wedges assist the client and the patient to bring this scoliosis shape closer to their physiological norm, which is a term we use a lot. But it isn't about saying, okay, you have scoliosis and let's fix you, because this is the shape of their spine. So can we say you have scoliosis, and can we ease the connective tissue? Can we ease the muscles that are part of that connective tissue into a position that will provide all of the tissues of the body a relief, a bit more air, a bit more room to breathe in, so that they can function a bit more with less strain. So we have the breathing, the elongation, we have the correction towards neutral, and then after that we include strengthening techniques. And these strengthening techniques can be very simple, or at least they look simple from the outside, because it could be breathing. Breathing can be your strengthening. The corrections, just bringing my spine into derotation and a lateral glide, can be my strengthening. And when we're ready, we're going to add a little bit of movement up and down of the legs or the head or the arms, and we're going to move within our corrections. And that really is key. So scolio Pilates, breathing, elongation, correction towards neutral with our wedges or with corrective positioning, and then strengthening to hold that position, to give the proprioceptive tissues that are ignited during the strengthening moments to continue their work after we're done exercising. Thank you.